So I wanted to share just a couple of thoughts with you about how having a 3D machine in my office has altered me and my diagnostic, kind of my outlook, my philosophy. It's interesting, over the last few years we've noticed dentistry beginning more and more than it has in the past to connect with medicine. And now, in my practice, as we're taking these 3D images, and able to see things, like carotid calcifications and, sinus issues and other issues with the airway, et cetera, et cetera. It's really dramatically kind of altering how I perceive not only myself as a general dentist, as a clinician, but also as a healthcare provider. It's really fun to have these conversations with our patients, where I can pull up the images in front of them and kind of talk them through what I'm seeing. And yesterday I had another patient that I created a little thumb drive for him and sent him to his cardiologist because he had some significant calcifications in his left carotid artery. It's nice to have these conversations with people. There are always some learning curves, some challenges that we run into as we're setting up a new machine, bringing a new protocol, a new process in practice. But it's, like I said, it's changing me in my mentality as I have assimilated the software and the procedures and the machine, and as the machine and the software and the procedures have assimilated me. So it's a lot of fun. I have a ton to learn. I've only just barely scratched the surface with the implant planning software and just barely begun to look into the TMJ and the airway. Most of what we're using it for is diagnostic purposes. And like I've mentioned in other videos, my protocol involves taking a full 3D, the high-res 3D, 8x15, for every patient that needs either a Pano or an FMX. And I usually take his full set of bite wings and photos, intraoral photos, at the same time for our new patients. So we end up getting tons of data, good information. I would much rather have a 3D than a PA in most situations, but we still have needs for PAs and bite wings, etc. The CBCT is not yet, at least our machine is not yet, to the point where we can use it to diagnose interproximal caries. So we need those bite wings and PAs from time to time. But it's an amazing process, and it's changed me, as I mentioned, more so than I thought it would. But I'm really excited to see going forward how it alters our practice in general. We have started to receive a lot of referrals from outside dentists and specialists, not only within the PDS environment, but outside of it. So a lot of fun, a lot of interesting things going forward. If you do have questions, please don't hesitate to check in with me. I'm happy to give you my honest feedback. There are always some concerns, whether it's the cost of the machine, whether it's protocols and processes and assistant training and whatever it is. Let me know what I can do to assist you. It's a really fun process, learning about and taking advantage of this new technology in our practices. So thank you.